Today we're talking about inflammation, because inflammation affects everything. Whatever it is that you're feeling, your achy joints, your belly discomfort, your allergies, your food sensitivities, Alzheimer's, brain fogs, anxiety, autoimmunity, depression, it's all inflammation. Inflammation affects everything. The brain and nervous system, the GI tract, your liver, your kidneys, your pancreas, your endocrine system, your hormones, your thyroid, your adrenals, your muscles, your joints, your connective tissues, your immune system, autoimmunity, you name it, it starts with inflammation. Now, inflammation is a spectrum, right? It ranges from, hey, I just don't feel good, like I-Don't-feel-Good-Itis, all the way to I have a disease, a diagnosis, a chronic illness. So we really need to talk about inflammation because it's everywhere. So before I start, I would like to let you know how to reach me and my team. And the way you reach me and my team is basically look us up on the New Method everywhere. New is spelled with a K because you always knew there's a better way. And we're everywhere on Instagram and Facebook. If you're on YouTube, don't forget to like and subscribe. If you are listening to me on a podcast, today I decided to wear my green reading glasses just to change it up, see what it looks like on video. But other than that, you're not missing anything. And let's dive right in and talk about inflammation, right? So there's good inflammation, right? Good inflammation, let's just say we fall, we hurt ourselves. And when that happens, the body recognizes that we have injury and inflammation comes to the area swells, it brings white blood cells, it brings cells to repair to the area. And the swelling is part of healing. And in a few days, the swelling goes down, the area heals. And this type of temporary inflammation happens every time you injure yourself or strain yourself. It gets worse for a few days and then it improves, right? We call that acute inflammation or short-term inflammation. Well, the problem is when the short-term inflammation becomes chronic inflammation. Chronic inflammation is a whole different problem. That's prolonged, it's chronic, and it wreaks havoc on the body. It settles in different parts of the body, the belly, the joints, the brain, and it creates this constant state of I-Don't-feel-Good-Itis, the kind of inflammation that stays with you all the time. And unless that inflammation is controlled or reversed, it will get worse. Now, chronic inflammation leads to disease. And depending on where the inflammation is, it will affect that organ. Inflammation in the brain, brain fog, Alzheimer's, inflammation on the skin, rashes, in the lungs, respiratory issues, joints, joint pain. So it really depends on where it is. But almost every disease starts with inflammation. And it's cooking in the body way before the disease becomes noticeable. By the time you have the official diagnosis, inflammation's already been there for a long time and already started doing the damage. We've met patients who are in different places on the inflammation. You might be on a different place on the inflammation spectrum. Again, ranging from, hey, I just have low energy and some like GI issues, or, I really can't perform at the gym like I used to, or maybe fatigue and brain fog, or all the way on the other side where like they can't even get out of bed anymore. They can't walk to the mailbox without debilitating pain. They can't sleep. They already have a diagnosis. So no matter where you are on the spectrum, you're inflamed. And you don't have to wait for this inflammation to become a disease, or you want to stop it before it becomes a disease. Or if you already have a diagnosis, you want to stop the inflammation before it worsens your diagnosis. So then the question is, what causes inflammation in our body? What's going on here? How did this happen? So each person's a little different. I'm going to give you some pathways to inflammation, and you could probably have more than one, but let's go over some of them, right? Oh my God, I've never done this with glasses. This is exciting. Okay, the things that get me happy. So one, physical injury. Getting injured is impossible to avoid. You're going to fall, you're going to cut yourself. But if you have consistent, multiple injuries over time, this will create chronic inflammation. So avoiding overstraining is important, right? For those of you out there who are the weekend warriors, you do nothing all week and then on the weekend you go bananas, you can be sustaining, this constant strain and stress on the body and these constant injuries repeatedly. That creates inflammation. So be mindful of avoiding repetitive, constant injuries. You know what happens to football players and boxers after multiple injuries. After a while, because they never get a chance to recover before the next injury, it starts becoming chronic. So think about that as you insist on doing the same thing every weekend that kind of lays you up for a few days because you just have to reach that milestone. You don't have to, okay? Don't hurt yourself. So that's physical injury. Then there is the psycho-emotional part, the mental and emotional stress that promotes inflammation and reduces immunity. And it often leads to sleep issues, which then exacerbates our inflammation. So this creates a loop. Inflammation messes with our sleep, then being sleep deprived gives us more inflammation. And it's a really hard loop to break out of. Just like repeated injuries, stress adds up. like building blocks, creating more and more inflammation. And when our bodies are burdened by these life events and our environment and the chronic issues, we know that this causes health problems and diseases. Number 3 on our list of how we get inflammation is infections. Now, of course, we can have a quick infection, a cold, a flu, and then we have a reaction, we fight it off. That's how we stay alive every time we get sick. But we're talking about when that inflammation doesn't go away. For some people, that means repeated infections. I'm constantly getting sick, constantly getting cold. Every time my immune system has to mount a response, right? Constantly battling an illness. That's a cycle. But then there's also people who have a chronic illness, a chronic infection, and may not be aware of it. The classic example are people who have Lyme for a really long time and may not even know it, or actively fighting a different pathogen. H. pylori is one of those things, and it can go on for years and years, and you have various symptoms, but you don't get diagnosed. And this whole time, your body is dealing with a chronic infection, right? And that is going to cause chronic inflammation. Next up on our list is environmental toxins. Our bodies are affected by our environment. We may be exposed to smoke, mold, chemicals, heavy metals. There's toxins everywhere. There's no way to avoid them, but for some people, it's really taxing to their system. Most people can clear these chemicals rather effectively. That's why not everyone around us is sick when they're exposed, but everyone's built different. And some people, when they're exposed to certain environmental toxins, and I don't necessarily mean crazy chemicals from a factory. Sometimes it's just having a candle burning in your office space all the time. That is a toxic chemical. And for some people, you can't clear that. So this can cause this constant underlying inflammation, which could really be an issue. Okay, then we have nutrition, the standard American diet. If you are still eating the standard American diet, it is so inflammatory. It's called the SAD diet. The acronym is SAD because it's sad. Okay, we were talking about the high-fat foods, the high-sugar desserts, the drinks, the red meat, the refined grains, the high-fat dairy products. Generally, it lacks fruit, it lacks vegetables, it lacks whole grains and fish and nuts. And of course, it's linked to obesity, heart disease, cancer, other diseases, and inflammation. Now, we already know that the carbs and the sugar can lead to diabetes. I'm not going to go through that. But remember what happens before diabetes. You have this pre-diabetes, this years of insulin resistance. This state of insulin resistance, this pre-diabetes, oh, don't worry about it. You're not diabetic, you're pre-diabetic, not a big deal. That's a state of inflammation because you're constantly trying to battle what to do with these carbs, right? And side note, this high intake of sugar and refined grains that you're like, no, it's fine. I don't have diabetes. I must be okay. I go every year for my annual. I'm fine. Guess what else it does? It also increases something called free radicals, which are molecules in your body that have an uneven number of electrons. I'm not going to go into it, but these free radicals cause chemical reactions, which is called oxidation. And oxidative stress is this imbalance between free radicals and antioxidants in your body. So a little bit of a technical paragraph there, but the point is that the standard American diet really causes inflammation on so many levels, even if you're just pre-diabetic. It's happening, it's inflamed, it's why you don't feel good. And remember, you cannot remove inflammation from any of these other sources that I'm talking about if you're still eating inflammatory foods all day. Okay, so we just have to get on that. Next up is leaky gut. Fancy word, GI permeability. For a normal, healthy GI, there's this amazing barrier of tight junctions, and it has an important job. It allows the good stuff in and blocks the bad stuff. But for many of us, if you're watching this, you probably already have leaky gut. That's why you're down this rabbit hole. But that barrier is loose, and certain proteins get through. And when those substances get through, the body reacts to it like as it would to a foreign invader. And this process causes inflammation. I did a whole talk on leaky gut, check it out, but quick paragraph on where the inflammation comes from. Now, here's something you may not realize. If you are currently overweight or in the obese category, not my categories, these categories already exist. You're beautiful, you're lovely, there's no shaming here. I just want to let you know that that state of extra weight is a state of inflammation. And now you find yourself in this kind of never-ending cycle because this excess weight causes inflammation. The inflammation causes disease and chronic issues like diabetes, prediabetes, which then causes more inflammation. And so you're stuck in this inflammation loop over years. And this is why, may not feel well. Now, it's not just, just lose some weight. It's not about that. It's about reduce the inflammation. Okay, and that's what we talk about. So I like to bring it up, but really important that there is no body shaming or anything like that. You're beautiful, you're wonderful. And it's not just about losing weight. It's about losing inflammation, okay? The whole point is that you have inflammation from multiple sources, inflammation in more than one area at a time. You can have leaky gut, you can, lack of sleep, you can have stress, you can have all these things kind of coming together, creating this big, intense place of inflammation, right? So the next question is, okay, I'm definitely exposed to all these things or have more than one of these things. How do I test for inflammation? This gets tricky, right? Because there are some testing. There's CRP testing. There's ESR testing. These are tests getting your blood work that shows what's called general markers of inflammation. But they're really general, meaning they don't tell you where the inflammation comes from. They don't tell you what to do about it. They just kind of say it's there. And what's even more important to note is that even if they're negative, it doesn't mean you don't have inflammation. It just means the test didn't capture it. So having a positive result, yeah, it confirms inflammation, but having a negative result doesn't mean you're not inflamed, okay? So don't want you to be like, oh, my CRP is fine, I must not be inflamed. No, not so much. If you don't feel good and you have aches and pains and you have issues, you're inflamed. And the markers take time before they show up. And this is important because some of you feel you go to your doctor, your NP or PI, and you're told everything's fine. All your markers are good. Great. That doesn't mean anything. It just means the markers didn't show up yet. It's going to take some time for them to show up. So don't get disheartened and say, oh my God, everyone's telling me I don't have inflammation. Just because the labs are negative doesn't mean you don't have inflammation. The bottom line is don't assume you're off the hook if your labs don't show anything, okay? If you don't feel good, you have inflammation. So the next question is, how do I get rid of this inflammation? Always start with the gut, okay? But why would I start with the gut? You just said it might be stress. You just said it might be environmental toxins. You said it might be an infection. Maybe I should get some fancy test, because you have to start with the gut, right? It might be mold. It might be food sensitivity. It might be your hormones. It might be so many things, especially if you Google it. There's a million tests and protocols and kits, but you always start at the gut. You have to first clear the weeds before you plant the trees. Before you even start considering any of the other tests, you might need them, but before you consider testing for mold and hormones and food sensitivities, you fix the gut first. You do this for two reasons. One, keep things simple. For most of our patients, cleaning up nutrition solves most of the symptoms without any additional testing or cost. So for most of us, we're already more than halfway there just by fixing nutrition. Super simple. Fix the gut, you fix most of the issues. Now, for patients who are more complex, if your issue is more complicated, we still have to fix the gut first, because let's just say you are positive for an infection. You do have mold, and we need to kind of remediate that or help you detox from it. You will not be able to handle the treatment if your gut is not on point. This is why you start with the gut. I talk about this in my book. You have to start with the gut. I won't even consider testing you for toxins or mold, or treating you for toxins and molds, or hormones for that matter, unless nutrition is already on point and I know that your belly can handle it. So remember, treating a patient for mold or Lyme, it's taxing. It's taxing on your detox system. It's taxing on your liver. I need to make sure nothing else is in our way getting to these other things. So trust me on this one. Doing it in this order, fixing the gut first, will actually save you time and money and frustration later on and get you feeling better faster. After all about to talk about with the gut, after that you still don't feel well, then you go into the vortex of other possibilities. Okay, so here's how it goes. How do you fix the belly? It's the 4R protocol. I did not invent this protocol. It's a very well-known protocol in functional medicine. It's been around for years. And this is what the 4R stand for. Remove, replace, reinoculate, repair. Okay, remove. You have to remove anything that's hurting your belly. That, of course, includes certain foods, but it also might include certain pathogens like H. pylori or other bacteria, right? So let's start with foods. There are certain foods that just have to go for everyone. Some of these obvious kind of, if you're still eating junk food, standard American diet, it's got to go. Because remember, people with leaky gut, and you probably have leaky gut if you're here, the more nonsense we eat, the more that goes into our system and creates inflammation. So this might, it's not a one size fits all, and depends where you are on the spectrum and your motivation level. But for some people, it's just going to be removing high fructose corn sugar. But for other people, it's going to be about removing gluten and dairy and corn and soy and legumes and grains, right? But it's not a one size fits all for everyone. Some people have to eliminate more intensely, and some people have to eliminate forever, and some people will only have to eliminate for a few weeks and may be able to be reintroduced later. I also recommend considering intermittent fasting because it helps heal the gut so much. I did a whole episode on that. Check it out. So remember, removal is not just about food. It's also removing pathogens. So if you have H. pylori, you have to treat that. That's a bacteria in your belly. Anything that is in your way of your belly being healed has to be removed first, right? This is why people say to me, what supplement should I take? I don't know. How's your belly doing? What supplements are going to help if you're still eating standard American diet and you're full of bacteria, right? So go to the basics first. So remove is first. Second is replace. Just as important as it is to take the troublesome food out of your diet, you also have to make sure you have good things in your nutrition, right? It's not just enough to eliminate foods. You have to put the good stuff in. This is important because some of you out there are like, you know what? I'm just going to eat like chicken and broccoli every day. These two things don't hurt my belly. I'm going to eat that forever. I'm good to go. Besides the fact that it's not realistic, it actually creates a new problem because your microbiome needs diversity. It doesn't like the same thing all the time. It needs different things and different bacteria and different sources of protein and different sources of phytonutrients. Diversity is important. So you actually have to venture out, try a new vegetable and a fruit, something you haven't tried before, different colors. Remember, those colors are important. They're phytonutrients. They have antioxidant, anti-inflammatory benefit. We're trying to get anti-inflammatory. Make sure you eat the rainbow. Now, in this replace section, some of you might also need other things replaced, like digestive enzymes. Some of you might actually need stomach acid in there. And yes, you're going to need some guidance here, whether you work with me and my team or a different functional medicine provider. But part of the replace phase of the protocol is to put the things that are missing inside. Right? That's what the R stands for. This brings us to the third R, which is reinoculation. This is when we put good bacteria into the gut. Another word for good bacteria is probiotics. Remember, we need to have a balance of good and bad bacteria. If you don't know about dysbiosis, try to find that episode podcast or on YouTube where I talk about dysbiosis. And one way to do that is with supplements. Sure, supplements are full of these probiotics, actually are pills full of good bacteria. Probiotics, that's what they're called. They're living bacteria in that pill. But there's also food that have good bacteria in them. Anything fermented, yogurt, sauerkraut, kimchi, kombucha, pickles, a lot of them have good bacteria in that. And then there's a whole world of prebiotics, which is basically the food that feed the bacteria. So you're going to want leeks, onions, asparagus, bananas, garlic, if you're allowed those things. The point is, I just like to let people know what prebiotics means. It's not anything fancy. Your bacteria are alive. They need food. That's prebiotics. Bringing us to the next R, which is repair. So we've removed the offending agents. We added some good nutrients, and then we added probiotics, okay? And now we need to repair the lining. We need certain foods and supplements to help us with healing. Certainly a clean diet is already starting the work of healing, and the probiotics are fixing the microbiome. But here I also like to add some supplementals. I like to add collagen, amino acids, which also help repair the gut, right? Super important. And if you don't want to use supplements, guess what? Eating bone broth is a great way to repair the gut. It is full of collagen and amino acids, and people, have been making bone broth since the dawn of time. So bone broth is just naturally full of amino acids and collagen because it comes from the bone, okay? I need you to know that as you start to do this, these 4 R's, this is where the magic happens. As you go through the process, you're going to notice how you feel. And if possible, keep a journal. In our office, we use software to track all the symptoms, but keeping a journal will do just as well. Pay attention to which things got better. What symptoms improved or disappeared altogether? Did the years of joint pain get better? Did that ringing in your ears, your tinnitus or tinnitus, however you want to call it, go away? The thing they told you will never go away, did it start getting better? Guess what? You're not imagining it. Is the bloating gone? The years of constipation? How about your sleep? Are you suddenly sleeping through the night? I can't tell you how in my patients I say, I can't believe I'm sleeping through the night just by changing my nutrition. Yeah, your nutrition affects how you sleep. Now, this is my favorite moment with my patients when they tell me, sometimes in tears, that they have never felt better. They can suddenly bend down to pick things up or suddenly have energy to exercise for the first time in years. Pay attention to your symptom. Are you experiencing less bloating? Did your skin clear up? Are the headaches better? Did the ringing in your ears stop? Did your constipation or your diarrhea improve? Are you sleeping through the night? Did the heart palpitations and sweating go away? And you're like, yeah, but is it really from my nutrition? Yeah, it's really from your nutrition. It really is. And once you start feeling better, you're officially a game changer. Go get one of the t-shirts, call yourself a game changer, because that's what you are. Because you've changed the course of your health destiny. Congratulations, you're amazing. And all you did so far was change your nutrition. But there's another reason I want you to pay attention to these symptoms, not just because it feels great, but you need to know what improved, which things got better. because that's how you're going to use to know when you can reintroduce. For example, let's just say your ringing in the ears got better and then you reintroduce, I don't know, a banana later on and the ringing in the ear came back. You have to know which things improved, because if it comes back, you know that you introduced something that was problematic. By the way, reintroduction is the fifth R. I know I said there's four, but there is a fifth in some protocols, which is reintroduction. Because at some point, you're going to want to bring back some of your favorites into your menu. And this has to be done methodically and carefully, by the way, slowly, one at a time, with journaling, with paying attention to what the symptoms are so that you can know what you can bring back. So, quick recap. If you're not feeling well, even if you don't have a diagnosis and you're just, I-Don't-feel-Good-Itis, you have inflammation. And if you already have a diagnosis, I don't care what the diagnosis is, you have inflammation. Now, there are probably many reasons for your inflammation. Remember, we just went through that whole list. So the question is, where do you start? Always start with your gut, because you have to start there. Even if there are other issues going on, even if you have mold, even if you have Lyme, even if you have hormonal imbalance, you have to start with your gut, because you need a strong gut to help you manage any other protocols coming down the pipeline. Remember, it's the 4 R's: remove, replace, reinoculate, repair. And then there is a fifth called reintroduction. That's a later stage. And if you're doing this and your symptoms are gone, your skin starts to clear up, your hot flashes go away, your joint pain is gone, guess what? You're done. You don't need to do anything else. You don't need to go down the vortex anymore. But if you're only feeling somewhat better, but you still have some issues left, that's okay, because now you're strong enough to be able to delve deeper into the next thing, whether it's Lyme or mold, etc. Remember, if you're listening, if you're in this vortex here with me, you are a game changer. You are changing the rules on your health. You are no longer sitting back and letting others tell you it's in your head. You are making the rules. Why? Because you always knew there was a better way. I hope this helps. I'll talk to you soon.